Cassava is really committed to doing scientific studies. They did have a phase 2 study, which was positive, which is great, which is placebo-controlled.
Yes.
And now they have 2 large phase 3 studies with placebo arms and with different dosages of the drug to really inform us if this drug is effective.
Yep.
So we can't really make any comments about the effectiveness of the drug.
Yep.
But what was striking in the phase 2 studies was that there was actually an improvement in cognition. So normally in a study, we're only expecting to see a decrease in decline of the patients in the study.
Right.
But in this phase 2 study, we actually saw patients improving with their cognition, which is quite remarkable because there's no other drug that's in clinical trials right now that actually has shown improvement in cognition. The best we could hope for up to now was less decline than the placebo group. So, that's very remarkable.
Yes.
So that's a very interesting feature of this drug.
Yeah.
The other thing is the safety. The side effect profile is very favorable.
Yes.
So I would encourage patients and families to enter this trial because it's not, there's no brain swelling. There's none of these terrible side effects that you see with the recently approved Biogen drug. So there are many positive features to being a participant in the study.
Yes. And
I think it's a very attractive study. But again, as I said, we have to wear our scientific hat, and we can't really make comments about efficacy until these phase 3 studies are well underway.
Yep. And I think that you sound a lot like Mr. Barbier and Cassava. They said we have to do phase 3 studies, of course, large placebo-controlled phase 3 studies, but that it was very interesting. And they didn't try to say this proves everything, but they thought it was very interesting as well. Yep. And one thing as you then brought it down to encouraging people to get into the studies because it's very safe. I did want to perhaps point to the anecdotal evidence having value there because there's a campaign to say that this is not safe. Are you familiar with a campaign to try to keep patients from entering the trials, perhaps a financially driven campaign to keep patients to be afraid of these trials?
Yeah, of course. I've read of some of these anecdotes and of some of these complaints, and I don't know what the basis of them. I can't think scientifically where this is coming from. In your last interview, you had suggested some big pharmaceutical company may be trying to suppress this, but I don't know that. And I wouldn't base any comments on that. I would think that the company will do what's correct. It's a very ethical company, and I don't think there's been any wrongdoing. And I think, the company's been punished by Wall Street and by some investors, but I generally want to be open-minded, and I want to conduct and be part of the scientific study to prove whether the drug is effective. We pretty much by now know from all the patients that have been in it that there's no harm. And the first principle in medicine is do no harm. Mm-hmm. So that's the most important thing. So by participating in the study, patients will be able to help advance this drug, get a drug free of charge, get all the evaluations at no charge. Yeah. And of course, the patients coming into the study do get paid if they qualify.
So this is a completely different method of action. Can you speak about the method of action and what your take on it is?
Well, this is a drug that targets a misplaced filament called filament A. And because in Alzheimer's disease, there is a genetic predisposition to this disease, and the genetics will kind of foster the development through A-beta-42, which is the bad protein of this filament A. And what Simufilam does, it corrects this formation of the filament A and prevents the drug from binding to these acetylcholine receptors, which produce something worse than amyloid, which is tau. So this is basically an anti-tau drug and prevents the propagation of tau through the brain, which may cause Alzheimer's disease. Wow. So amyloid is important. Tau is probably a lot more important.
Interesting.
And I think that this drug seems to have the right properties to prevent Alzheimer's from progressing. In the phase 2 study, which is very encouraging and the drug did move the biomarkers, and the Biogen drug was approved mostly on the biomarker results. So in the summary of results on the cerebrospinal fluid biomarkers, we did see robust improvement in the biomarkers.
An entire panel repeatedly did the phase 2A, the 2B, and then the continuation open label. Yeah.
So the timeline is a very interesting question because, if we look at the memory effects that we did in the phase 2 study, we did see an improvement in a short period of time on the episodic memory improvement and spatial working memory improvement.
Mm-hmm.
So, those can be detected fairly early. We're talking about the symptomatic effect of the drug.
Yep.
So, after 6 months, there was, an improvement in the ADAS-Cog 11. 9 months and 12 months, that constantly, it was an incremental increase. So,
yes.
You got a 0.1, 0.5 change in the ADAS-Cog after 6 months, and a 3 point after 9 months.
Yes.
So it seems like 9 months was pretty critical for this change in the ADAS-Cog.
Yes, and I think it improved a little further at the 12-month point as well.
It did.
Yes.
It went above the -3.
And then we've seen in small molecules that target misfolded proteins that is. I looked at a study that looked at a number of them, and they all, the ones that had long-term studies, all of them, there were 7 that the study looked at. 4 of them had long-term studies, like 2.5 years, and all of them got an increasing benefit over time. So is that something we could possibly, and that would be, and what we're seeing, like you just said, those numbers at 6, 9, and 12 months, this is in a disease of continual decline where just staying steady would represent continual increase. Yeah. Is it a possibility that patients could continue to get better?
Yeah, definitely. We definitely see, as we said, a more improvement after 1 year than after 6 months, and definitely much more after 6 months than after 3 months.
Yeah.
So,
yeah. Thank you.
Those were all significantly improved.
Yes. And there's the behavior as well. Do you have any comments on, for some people for some people, as far as especially the caretakers, the behavioral issues can be the bigger thing. There's been not as much data, but some interesting data as well there. Do you weight that data at all, or have you looked at that data?
Behavioral issue problems in Alzheimer's disease is really what pushes people into a nursing home. So yes. Any drug that can change it. It's not the memory that puts people into a nursing home, it's the behavioral, the agitation, the biting, the screaming, the throwing. If those behaviors can indeed be improved by this drug, it would save a lot of money, because nursing home placement is really the biggest cost in Alzheimer's disease. So we're always looking at, behavioral measures of a drug and behavioral measures to see if the drug is improving those.
Yes. I remember seeing a study that it was around 2019, that if you paid all the caretakers like $13 an hour, then along with all of the direct spending as well in Alzheimer's, everything in Alzheimer's came to like 3% of GDP, Alzheimer's spending. So, yeah, and it's set to get much, much larger. So, wow. Speaking of,
it's really frightening.
Do you have any comment about what the CMS is doing, or if Biogen will be successful to change their minds?
Well, I kind of agree with what they're doing. I don't think that, based on the scientific evidence, even the scientific advisory committee of the FDA disagreed with the FDA findings. So
and resigned.
Yeah, there were a few resignations in addition. So, that kind of smacks more of misconduct than anything we heard about with this drug. So I think the company here has been very ethical, and they're not saying this drug is the greatest thing on earth. They're just saying,
Yes.
we're very optimistic. We want to see how the drug works in clinical trials. And that's what I want to see. I mean, I'm totally objective. I'm not going into the study saying to patients the drug is going to work. We have to say it's a clinical trial. You may get the drug, you may get the placebo, and we have to see how you do in the study. There's no guarantees, but this is definitely a study I would refer a family member into. So, I mean, I feel very positive about the study design, the study outcome, and the safety of the drug. So there's no good reason for a patient not to enter the study.
Thank you so much. Yep.
I would really kind of poo-poo all the negative comments because I don't think they're based on any facts. I don't think there's been any wrongdoing on the part of the pharmaceutical sponsor. I think we just need to get down and do the study and then present the results, whatever they are, positive or negative.
There is still a chance that these trials are stopped. And there's a citizens petition open with the FDA right now, filed to stop these trials. And so the question is, how would you feel if the FDA gave in to this request?
Well, I would doubt, first of all, I would doubt that the FDA would, I mean, they would have to show malfeasance on behalf of the pharmaceutical company. I would be very surprised, in fact, shocked if the FDA stopped these trials.
And now Cassava is also getting funding from the National Institute on Aging for Savadex. Right, which is a potentially very exciting blood test, which could possibly tell you ahead of time before you have symptoms, maybe, possibly, that you could have Alzheimer's happening. Can you comment about if that? I don't know if you've looked at the data around that or not. I think something was published on December 31st, as a matter of fact. But have you looked at the data? Yep. Have you looked at the data around that? And yep.
Yeah, very interesting data. There are several companies that have advanced testing for Alzheimer's and a blood test.
Yep.
So, in the old days, we had to do a postmortem, then we had to do spinal fluid. More recently, we've had to do PET scans. But the blood test may obviate all of that, and we may be able to test people in large numbers for Alzheimer's disease to see if they have the genetic positive test. And it measures the amount of amyloid and tau by a blood test. And so that is really something that we're incorporating into some of our clinical studies that are starting up now.
Thank you very much.
And the fact that the Cassava is running this study in tandem with National Institute of Aging really gives it, National Institute of Aging is pretty strict about who they will fund. So the naysayers, why would the National Institute of Aging want to sponsor this study if the drug is not promising?
And they've gotten almost $30 million from them by now as well.
Right.
Yeah.
So it has to have scientific merit. The company has to be reputable. So this kind of speaks against all the bad press that Cassava has unnecessarily got.
Agreed.
So, we're looking forward to positive data and even negative data if that's the case, but we just want to have data and we want to have patients come into the clinical trial. As I said, I think we feel very positive about this clinical trial. We'd encourage everybody who's thinking about a clinical trial to enter this or go to a center that does clinical trials and see if you qualify for one of these studies. And, this is one of our best studies, but we have other good studies as well.
Yep. Thank you very much. And then that was PrincetonMedicalInstitutes.com?
Yeah.
PrincetonMedicalInstitutes.com, and that's how you can get screened.